Okay, hi everybody. Welcome to our second class. Again, this will be the last time I'm doing a video class because, like I said earlier, I'm not in town, I'm unavailable somewhat. Hopefully, some of y'all emailed me, reached out to me regarding some information about the course, blended learning. So by the time you watch this video, hopefully I would have set it up. If not, you get an extension on all the homework and the due dates. And even so, by the time I come back next Monday, I'm going to have it set up for sure. So keep an eye on that. Please keep emailing me. So, like I said, for a lot of our class, it's going to be building off a lot of our key components. And if I forget to talk about something or I run out of time to talk about something, we're going to review it with the next class. So let me hop back to our previous PowerPoint. So, like I said, this class has a social justice component added, and the social justice component is going to be talking about the untold history of street medics. Like I said earlier, street medics were primarily around and active during the 1960s and 50s. Majority of them were first generation, were or had a marginalized identity. So a lot of them were Black and brown people. And what they would do, or street medics would do, is they would be employed within the medical field. So were doctors, nurses, EMTs that would go back to their own communities to provide free health, low insurance, any type of medical assistance. Just because, again, at this time, insurance was very barred, it was very segregated. The government really didn't have any resources for minoritized people, so the street medics really did a lot of instrumental work in providing free first aid care or care to the communities that they were involved in. So we're going to start off with a little bit of an intro video with them because I didn't have enough time to talk about this video last week. So check it out. I'm going to hit play.
On March 9th, 1965, Dr. Martin Luther King Jr. led civil rights marchers to the Edmund Pettus Bridge in Selma, Alabama. Marching behind Dr. King were a medical doctor and a nurse carrying first aid gear. The two were members of the Medical Committee for Human Rights, on hand to be a medical presence and to treat marchers in the event of violence.
The Medical Committee for Human Rights started up at the beginning of Freedom Summer in June of 1964. In Mississippi, there were probably around 100 altogether, doctors, nurses, and social workers. They came for usually periods of a week each. Most of the doctors were white. A few of them came down were black.
MCHR volunteers would stay with local Black families or in motel rooms. Although they were not officially licensed, they could legally administer emergency medical care. MCHR staffed 5 medical centers with volunteers.
The Medical Committee for Human Rights really became the medical arm of the civil rights movement, whose mandates, number one, was to take care of civil rights workers and local community people who could not receive appropriate medical care, to challenge segregated waiting rooms and doctor offices, to try to provide support to local cooperative physicians, be they black or white.
MCHR staff were stunned by the conditions of medical care in Mississippi.
Segregated care looked horrible. It was so obvious and blatant. The rooms for black patients were dilapidated. The beds were old. The equipment was old. You immediately felt you traded your dignity for care.
Hospitals in the South often denied medical care outright or forced black residents to pay up front.
We had no way to transport people on the march. The local government would not supply us with ambulances to transport people to the hospital. The black funeral directors supplied us with a hearse as an ambulance.
MCHR soon worked to end segregated health care in the South. But first, the committee was called to Selma. The Selma to Montgomery March was originally planned as a protest of the death of Jimmy Lee Jackson. On February 18, 1965, Jackson marched with protesters on the Perry County Jail in Alabama. Local and state police attacked the marchers. Jackson tried to protect his mother and elderly grandfather, and an Alabama state trooper shot Jackson in the stomach.
He was carried to the Marion Hospital here in town. He stayed there about an hour or so before, and nobody would wait on him. Then he later was taken to the hospital in Selma, where he did receive services.
Jimmy Lee Jackson died 8 days later at the age of 26. Fearing more violence, movement leaders in Selma asked MCHR to send medical workers. The doctor and nurse in the background were asked to march with Martin Luther King Jr. in case he too was met with violence.
We hope that this will be a peaceful, non-violent demonstration of our determination to register and vote.
MCHR continued to provide medical presence for the civil rights movement for years to come.
So, as you saw, a lot of the key issues that are prevalent today, access to healthcare, access to public healthcare, even access to EMT or EMS, highly segregated, highly barred. Even now, in my experience, that being or working within first aid, that a lot of people that I know, even when I perform a rescue, people come out saying, I don't want an EMT ride, don't call 911. They don't want to get hit with that EMT bill or EMS bill because, like the video presented, access to that or government access is highly, highly restricted. And even now, how I'm talking, it's so expensive. Many people's insurances don't cover that. Public insurance doesn't cover that. So I say that just because a lot of the things in the past, this is only like 60 or 70 years ago, still happening today. So that's the second, tertiary component of this class, learning the social justice, how it's intertwined within first aid. And again, once you're certified, whatever you do with your first aid certification, it's all up to you. But I really want to present this opportunity that you can use to give back to your community, as many people in the past have done. So check it out. Here's our agenda for today. Like I said, it's going to be building off a lot of last Monday's course. And as the weeks go by, it's going to be continuing to build up. So one thing I always like to do is I always like to do a quick review over the last class, and these reviews are going to have the final exam component added to it, skills tests added to it. So when it comes to sizing up the scene, what are you looking for? Again, you're entering a dangerous zone. What are you looking for? Anything that can hurt you primarily, or really anything that puts your life in danger. As American Red Cross states, the scene must be safe for the rescuer to act and perform the rescue, because if the scene's not safe, then unfortunately you can't go in there guns a-blazing. You have to take care of yourself first, because you are the trained medical professional. Nobody else is. If you get lost or you lose your life, unfortunately that puts the whole community in danger. So Good Samaritan law, what is it? Again, this was on our last class. Just I'm hoping somebody raises their hand and shouts it out. Do me a solid and post it on the Edmodo if you know what it is. And lastly, pulse check. The pulse. That is what is going to tell you if a person's heart is beating. Where do you find it for an adult? So an adult can be pretty much a child that's taller. I mean, we say it's like children over 5 feet, but where is it located? How can you find it? On an adult and an infant. So sorry if I have that mispronounced or misspelled on the PowerPoint. Adult and infant. So where do you locate the pulse? Again, if you can't find it yet, go do some push-ups, go run. When I get back in person, I'm going to show you how to locate it. So again, if you don't know, ask a friend. You can try to YouTube it, but again, YouTube might send you to do this type of pulse check. Don't do that. But yeah, how would you locate the pulse? So answer on Edmodo. Now, since this is technically being recorded in the past, I'm going to assume that everyone signed on to Blended Learning and read the syllabus. Again, if you have any questions about the syllabus or Edmodo, please shoot me an email, shoot me a message. I'll be happy to get back to you. So I'm going to assume that things went smoothly this year for signing up with Blended Learning. Like I said, if you haven't done it yet, you need a separate email account or your personal email account that you're going to use to register for Edmodo. Once you're on Edmodo, there's going to be a Google Drive link that's going to ask you for your first name, last name, and email address. Once you give that to me, I can have the Blended Learning course set up for you. So again, if you haven't got the email, and if I haven't been able to create the class, I'll put that on Edmodo, I'll contact y'all, but more than likely I have. So again, biggest priority, sign up for Edmodo, put your email address and information in the Google Drive link provided on Edmodo, and then you can access the Blended Learning course. I'm going to have a video on Edmodo that's going to explain more in depth on how to sign up for the American Red Cross Blended Learning portion. So again, just keep contacting me, keep checking, check your spam. If I've sent out a notification saying, hey, I got the Blended Learning portal set up. So that's all I'm going to review with the syllabus and Blended Learning at the moment right now. So continue on with today's lecture. So as a trained first aid professional, hopefully in this course, we would have gotten our first aid kits. These first aid kits are primarily given to our students who are in this course, and all the equipment you need for this course is going to be in those little kits. Moreover, I've selected these kits because they're very portable, they're friendly. If you want to take them to a football game, when you're going hiking, leave it in your car, please do so. If you want to go hard, and I mean hella hard, you can carry it in your backpack, and once you carry it in your backpack, you're always ready set to go to perform a rescue. So within your first aid kit, there's always going to be a thing called PPE, personal protection equipment. This is going to protect you from any type of bacteria, exposure to any type of diseases, like especially COVID-19, and even when we're coming in contact with the possibility of someone else's blood, PPE is going to protect you from that. So PPE can range from gloves, it can range from glasses, sunglasses, and face masks. So we'll be working today with disposable gloves. And again, I promise, even though I'm not there, when I get back, I'm going to show you everything we learned in maybe 5 minutes or 2 minutes. So from now on, whenever you're in a public place, locate the AED. So the AED is an automated external defibrillator. This is the thing you see in movies that a lot of people like to put these two rods together and go clear. The AED is a device that restarts the heart in the event that the heart is failing to pump. What it does is sends an electric jolt through the body. And again, we will be reviewing that in this course. And even in saying that, you're going to learn how to put the pads on correctly. Yes, there are pads. There's two different ways to put on pads, one for infants, one for adults. So again, I just want to get you in that hero mode. Just spider sense is going every time you're somewhere out there. I'm in a library, I'm in a school, I'm in a mall. Where's the AED? There's always an AED located around somewhere in a public space. So like I said last time, whenever we're doing rescues, we always want to get some form of consent. If the person or victim cannot talk and you need to perform a rescue, you have implied consent. They can't sue you. If you're dealing with an infant or child or baby, if you can't find the infant or child, you can't find the infant or child's parent, you still have implied consent. But if the parent is there, you have to ask for the parent's consent, like, hey, my name is Roberto Reese, I'm a lifeguard. I see that your son is choking. Can I please provide care? Yes. In this scenario, if I couldn't find the kid's parent, kid's choking in front of me, I'm going to perform the rescue. Because again, I have implied consent. So in saying that, another terminology we're going to learn today is called negligence, failure to act during employment. So if you're being paid to be a nurse, or in my case, if I'm being paid to be a lifeguard, and I see someone actively drowning, I don't do anything, that's considered negligence. And that can have serious repercussions because, again, American Red Cross is giving you the material to provide that rescue. Moreover, you're being paid to do it. So always keep that in mind. this, again, the legality behind it is, again, to really encourage you to go out there and save that person's life. So now we're gonna get into the nitty gritty. When it comes to, like I said earlier, calling 911, you want to ask for specifically the EMR, emergency medical response, or EMT, because again, what's going to happen most of the time, you're going to get deal with the operator. Hey, 911 operator, what's your emergency? Hey, I have someone who has a heart attack at Cal State Long Beach. Please send someone over. We're located on the 3rd floor. You want to be very descriptive. When you're calling 911, again, just go straight to saying, transfer me to EMT or EMS. A lot of times operators will try to figure out what's going on, but if you go straight to the point saying, hey, someone's having a life-threatening emergency, connect me to EMT, EMR, boom, you made the process so much easier. So we'll be going over today's SAMPLE. SAMPLE, and again, within American Red Cross, SAMPLE is an acronym that is used to help identify what's going on with your victim, even after you provided care. We're gonna go over that in a video in a bit, but just again, just write that down for me, SAMPLE. So I don't have this on me, but being a first aid trained professional, you're going to have a lot of devices and equipment ready for you to provide rescues or even care. On the bottom right corner, that's an O2 tank. I will bring that to class at one point. And on the top, that's a nasal cannula, non-rebreather, obstructed airway device. I'm sorry, the bag valve ventilator. All of these devices can be connected to the O2 tank, because the O2 tank, what it does is provides oxygen for somebody who can't breathe. It can be used for unconscious and conscious victims, but you want to use specific devices like the non-rebreather and BVM on specific victims. You can't just use it on all of them. Same thing with the nasal cannula. You can only use that when a person is conscious. And yes, there's a razor there. A lot of the times if you have to use the AED device, you see the person's chest is hairy. A lot of AEDs have a razor blade, so you have to shave off their hair. And the obstructed airway device, the choker, it's literally looks like a gun. You stick it in someone's mouth. You want to make sure it's not too deep inwards, like just at the base of the tongue. What it does is when you press down on it, it pulls oxygen out of the victim's mouth. And let's say if homeboy had a hot dog, choked, you put that obstructed airway device in his mouth, you inhale or you pull the trigger, out comes a hot dog. Just because in the past, a lot of people do rescues and you're primarily supposed to use your pinky or finger to scoop whatever is out there. Sometimes the person has convulsions, the body jolts, and it can sometimes bite you. So if you have the device available with you, use it, the obstructed airway device. In this class, we will be going over how to care for obstructed airways or care for choking victims. So whenever we're calling 911, again, you won't get charged or you won't get billed if you call 911 and EMS arrives. It's more of the ride from wherever you called to the hospital that you get billed. So one thing you want to identify as a rescuer is your victim's levels of conscious, LOC. Are they having problems breathing? Are they having a seizure? Are they vomiting blood? Again, with the person's level of consciousness, it can range from different things. Like right now it's hot. I'm assuming, or I'm hoping that we have a room full of AC, but let's just say it's blazing hot, it's 90 degrees. And you see my skin get clammy, I'm pale, boom. That's already telling you, hey, like what's going on with Rob? Why is he clammy? Why is he sweaty? Valentine's Day passed, like what's going on with him? That's an altered level of consciousness. At that point, it's your judgment call to say, hey, I don't feel comfortable with how this person looks, or more so, if you see someone having a loopy face on one side, again, that's an altered LOC. That person's going to have a stroke. If you see a person having their arms crossed, red, faces flushed, red, that could be a heart attack. I say all these things because, again, it's a change in a level of consciousness. It's a life-threatening condition. At that point, since you're first aid certified, you want to provide care until EMS arrives. And like I said, tell the operator, connect me to EMS or EMT. Moreover, if you're providing care and you find the person not responsive, you tap and shout like, hey, come on, bud, wake up, wake up. Not waking up, check their pulse, call 911. So again, levels of conscious, call 911 depending on the one you see or that you feel comfortable with, like that tells you, hey, this person needs emergency medical care. So starting with one of the common LOCs, levels of consciousness, is heat-related illnesses. There's primarily three we talk about in American Red Cross, and these three can very much range. It's very common. Again, when you're out on the beach, carry water, hiking, carry water. Water goes a long way. I know at Dominguez High, there's only like one water station, but oh my God, I live by that water station. I love that water station. And at Gardena, yeah, there's no water station. So I say that just because, again, when it comes to heat-related illnesses, there's pre-treatable. So heat cramps are basically spasms in the muscle, legs, or abdomen that are caused by the lack of fluids and electrolytes. Homeboy hasn't eaten, he's been eating improperly. Basically, if you're out jogging and you feel a sharp pain in your leg, that's a heat cramp. Again, with heat cramps, don't call 911, just tell the person to relax, stretch it out, have some water, good to go. Heat exhaustion, that's a little bit more serious. So let's say it's a hot day, you're running on the beach, you're hiking, and then you notice the person has an extremely sweaty body. That's heat exhaustion. That means that human's body has exhausted more water than their body can cooperate. So they typically need a little break, just put them in the shade, give them some water. Now the heat stroke, that's primarily the one you want to look out for. That's the one where the body can't regulate its temperature. It's too flippin' hot. And this is a common injury you would see during basketball games, baseball games, really any time. I'm sorry, not basketball games, football games. Because again, players are actively playing in the sun. It's hot. They haven't regulated their body. To begin providing care for any heat-related illnesses, get them out of the heat source, put a shade, and start providing care for a lot of heat exhaustion and heat strokes. You want to put ice on them. You want to douse them in water, keep their head above water. It's primarily easy to care for heat-related illnesses because, again, if you see on your weather app, it's going to be 90 degrees or 95. Oh my God. Like, as a first aid responder or someone who's knowledgeable in first aid, you're going to know, like, okay, this is going to be a day where I got to make sure you're not wearing pants, you're wearing shorts, that you're properly have water to drink. So that's heat-related illnesses. So breathing emergencies. Breathing emergencies can go a long way. In this course, we will be learning about how to treat for allergic reactions, but in this course, we'll be focusing on anaphylactic shock. Basically, that's if someone has came in contact with something they're allergic with, like peanuts, radishes, pineapples, apples. Basically, what happens is once that food gets into contact with the person who's allergic, that person becomes swelly, becomes red. Where it becomes a problem is that if it becomes too red, where it becomes difficult for the person to breathe. So what we're going to also learn in this class is how to provide an EpiPen. So EpiPens, when we're looking at EpiPens, always look at the expiration date, check if it has the person's name on it, and again, get consent. Hey, sir, I'm a lifeguard. I see that you're allergic to nuts, pineapples. Do you have an EpiPen and I can help you with the EpiPen? Basically, with the EpiPen, all you have to do, you grab it, a bottom portion, you cap it off, don't touch that bottom portion, take the top portion off. What you want to do is you want to take the EpiPen and just jab it in between the person's leg. You're going to see in the video right now. And I will be bringing EpiPens in the course for you to use. So trainer EpiPens. Let's see, can I get this thing to load?
You've learned how to check a person for signs and symptoms of anaphylaxis and when to call 911. You also know that caring for someone with anaphylaxis means administering epinephrine. The correct technique for this is easy to learn and can help save a life. Here's what to do. Keep in mind, these instructions are based on the widely available EpiPen. If you are using a different epinephrine injector device, be sure to follow that manufacturer's instructions. First, if you are just coming onto the scene, you'll need to determine if the person has already taken epinephrine. If so, a second dose should only be given if EMS is delayed and if signs and symptoms get worse, or if they temporarily improve, then return again after several minutes.
Did you use your epinephrine auto-injector yet?
No, I haven't. Can you please help me? Once you've confirmed the auto-injector is prescribed for the person, remove the device from its carrier tube or package if it has one. Check the expiration date. If it has expired, do not use the auto-injector. If the medication is visible, make sure the liquid is clear. If it is cloudy, do not use it. Before giving the injection, you should put on gloves. Then, locate the outside middle of the person's thigh. If you are giving the injection through clothing, make sure there are no obstructions at the site.
Do you have anything in your pockets like a cell phone?
So, like you saw, if the student or person is having an extremely difficult time breathing, call 911. And as long as you have the person's EpiPen there, you can use it to provide care for the person. So, like I said, you want to look out for EpiPens. Take the orange part off, blue part. That's what you use to inject the person. So don't worry too much about it. A lot of the time, people who are allergic, they're going to have an EpiPen available, and they'll probably tell you how to use it. But on your case, if someone says, "Hey, your friend is allergic to radishes, I have an EpiPen I can lend you, that's my son's." No, every EpiPen is specifically designed for one person. So that's EpiPens in a nutshell. Asthma attacks. So asthma attacks, that's a sudden change in LOC, levels of consciousness. When it comes to asthma attacks, all you really have to do is you can help provide and you can help guide the asthma inhaler into the person's mouth, press it. But a lot of times when people have asthma, they'll be carrying their inhaler with them. They'll notify you. I go to the gym a lot, and a lot of people don't have their asthma inhaler lying on the floor. So when it comes to asthma, more than likely the person's always gonna have it available. It's very rare that there's going to be an athlete who doesn't have their inhaler near them. But in that case, help them look for it, ask them like where'd you put it. So asthma attacks. Now, bleeding control. When I come back in person, when we have our first aid kits available, we'll be using our gauze to learn on how to bandage a wound and treat a wound. But basically, bleeding control, there's 4 types of them. You fall on your skateboard, your bike, that's an abrasion. You got the top of your skin rubbed and cut. An avulsion is basically a harder puncture or a hard punch or just a harder force of contact to the skin, and that's going to open up the skin. So puncture. Puncture is when you have an object embedded in the arm or really anywhere. And the last one, the laceration. So that's a deep type of cut. You can see the skin, you can see primarily the flesh, the meaty part. Regardless of any type of bleeding control or wound the victim has, your role is to control the bleeding. Because again, when providing care, your first role is or primary thing you want to look out for after you get consent, bleeding control. Hey, are you bleeding? How can I bandage the wound? Any type of wound you come across, you will learn how to treat it. So when it comes to bleeding control, gauze and dressing are our best friends. We're going to have and demonstrate in person when I return to class. So this was a common topic that a lot of our students brought up last semesters, and I'm incorporating it now just because, again, it's something that is sadly relevant. And as first aid providers, if you're on the scene and you're working as an EMT, this is something you're going to need to learn. So when it comes to gunshot wounds, you want to pack and control the bleeding. So packing is the same concept as using gauze and treating other types of wounds. You want to stop the bleeding, so you want to pack it and just to control the bleeding, because at that point you have to wait for EMS or EMT arrive. Shock is when the person is having extreme thoughts, they're having a hard time breathing, they become nauseous. Talk to your victim, because shock can happen primarily in any type of care. So let's check out this video.
And the SWAT tourniquet.
I'm going to fast forward
contains a
because
third medical adjunct for controlling traumatic committee on population and the form.
So this person is using gauze, just as an FYI. It just sounds cooler, I guess. Combat gauze.
Safely expose and examine the wound and identify the point of bleeding. Then remove excess pooled blood from the wound while preserving any clots already in the wound if possible. Next, begin to pack the combat gauze into the wound, directly over the source of bleeding. Ensure you have good initial contact. Use as much gauze as needed to stem the blood flow. Continue to pack entire dressing while maintaining good contact. The remainder of gauze can be applied on top of the wound or to wrap the wound as required. Quickly apply pressure until bleeding has stopped.
So you see that whenever we're providing care for any type of bleeding wound or bleeding control, you always want to put pressure, just because again, we put a good amount of pressure on any type of wound, that can prevent more blood from coming out. So in this case, you saw the rescuer, he packed the wound, and at some part he left the gauze unrolled on the top, so then the gauze can start absorbing all the blood and again preventing the loss of more blood from the victim.
3 minutes of continuous pressure is suggested. Leave gauze in place and wrap to secure it in the wound. Periodically check the placement of dressing and ensure it is properly placed and that there is no active bleeding from the edges, but do not lift dressing to reassess. Occasionally, the bandage will become soaked as there will be active bleeding. In this case, entirely remove the old gauze and replace it with the new one following the same steps. Utilize a pressure bandage or an elastic bandage, such as a SWAT tourniquet, in conjunction with the hemostatic gauze for maximum bleeding control. Make sure the empty gauze package containing removal instructions is sent with the patient to the hospital.
So as you saw in this video, the person had tape to cover the gunshot wound. In other cases, we're going to use our triangle bandages or another type of bandage to tie the wound down. I'm going to show you how to do it. But again, in many instances, if you only have a first aid kit, you might have the bare necessities. Even with the bare necessities, you can do a lot to begin care for the victim's life. So now, tourniquets. Tourniquets are back. So in many instances, if EMS or EMT hasn't arrived, or in our previous lecture or previous slide, gunshot wounds, sometimes you need to do a tourniquet. So again, tourniquets, they hurt a lot. Don't do it to everybody. Just if you feel that it's a do or die situation, if the person has a laceration, a bulging, if you know you're hiking, if you know it's to take EMS forever to get to you, use a tourniquet. Don't use it willy-nilly if someone falls off a bike. Just tourniquets are back, but again, use it for a life or death situation. So check it out.
What we're going to do now is look at improvised tourniquets. Now, you'd only consider using an improvised tourniquet exactly the same as a commercial one if direct pressure has not worked. Now, it may well be that you're out and about, you don't have a commercial tourniquet available, so you need to use whatever's to hand. What we're doing here is using a triangular bandage, but you could use any strong pliable material like gauze material, triangular bandages, clothing. We want to have something that's tight, but also that's not going to be too tight to cause problems. So try and make sure it's at least 5 centimeters thick. Don't use things like wire or string or rope or shoelaces, as this will cause damage and will just cut into the muscle on the arm. Also, things like leather belts can be a problem because you won't physically be able to tighten them up enough. Never put an improvised tourniquet over the actual wound site or over a joint, but they can be placed over clothing if necessary, but they are best if they can go directly onto the skin. So we're now going to look.
So like the video said, you don't want to put it on the wound. You want to put it above the wound. You don't want to put it on the joint. A lot of Hollywood movies like to show people using belts. You can use a shirt. You can use a cloth belt. It's really, really easy to use and learn. So you can see in the video.
Look at how to actually apply a tourniquet. So all I've done is I've folded up a triangular bandage. So it's around about 5 centimeters minimum thickness. What we're doing is placing this on the upper arm. So simulating there's a cut just about here on the arm. So place it on the upper arm. We don't want to go too near the joint. So we just want to make sure that it's in on the mid shaft of this bone so that we can put it on and stop all arterial blood flow. To start with, all we're doing is taking the dressing, tying it in a half knot over the top. Just pull that so it's tight. And then we need to be able to tighten it up. So we can use anything to hand. I'll use a knife here, but it could be anything, a strong lump of timber or metal or anything that you've got to hand. But just be careful about using things like a pen, because as you tighten this up, it's likely the pen will break and it won't be efficient.
So it's really easy. You want to tie a knot above above the area that needs care. You use a pen, you start twisting and twisting and twisting. When you feel it's at a tight point, take the pen out, you're gonna tie the knot down. You'll see.
If you've laid something over it, then take the bandage and just tie that in place. And then using the knife, just wind it round. So all we're doing is we're just winding it round and applying more and more pressure. As this is going on, it will be uncomfortable for the person. So you do need to be telling them that, you know, this is going to basically save their life, because we need to stop this bleeding. If you apply this on until it's just tight, then the problem there is you're going to stop the venous venous return and not the arterial. So the blood is going to go this way, but nothing's coming back. You need to stop all blood flow. So keep going tight. And if it is still oozing blood out, then you need to, or spurting blood, you need to put more pressure on. But once this starts going on, it will slow the blood flow down, and it will hopefully start to resolve the problem. Once you've got it into the right position, just using the tails, tuck that round, and then you can go underneath and tie it in place. Once it's tied securely in place, the tourniquet can be left in place. There's no problem with it coming off. If you do see blood flow, you can apply more pressure. But one thing you don't do is take this off. You leave this in place until they get to the emergency medical rooms. Other thing with it is don't cover it over. We must make sure that all emergency services know that the tourniquet has been applied. If you cover them over with a coat or something like that, it may be, in some cases, it gets missed. So when the paramedics arrive, make sure you tell them you put a tourniquet on. Also, you get a pen. You can write a T on their forehead and the time you applied the tourniquet. That's important so that the doctors in the hospital know how long this was in place for. That can help with their treatment of the casualty. So improvised tourniquet is a very, very effective way of stopping bleeding if you don't have a commercial tourniquet available.
So like I said, tourniquets, use them in a life or death situation. A lot of times you could tie them off. In this case, the rescuer just decided to leave it there. So don't use tourniquets for bicycle falls or skateboard falls. Now, after you provided care, here's the acronym we were talking about earlier. It's called SAMPLE. S stands for signs and symptoms, identifying what was wrong with the victim, seeing where the pain was, asking the victim, hey, what kind of allergies do you have? Are you allergic to anything? And medications, you want to ask the victim, like, hey, are you taking any past medications? P stands for pertinent medical history. Hey, sir, have you had these seizures frequently? Have you been having these strokes a lot? L stands for last food or drink consumed. So what was the last thing you ate? You ate raw sushi. Okay, that makes sense why you would have an obstructed airway. Your face would turn clammy. And E, events leading up. Hey, sir, so tell me the whole story, how this all happened. So the primary assessment, again, it's going to give you a story. It's going to give you an idea of how to follow up with the victim and how to take note of provide more medical care. And the secondary assessment is really just checking the victim's head to toe for anything you might have missed. The person could have a cut on his face. He could be bleeding. You wouldn't be able to tell. I mean, you could, but again, the head to toe assessment is going to tell you, like, okay, where does it hurt a lot? You want to have consent when you're doing this, slightly pat them down. When you're doing it to a minor, or you're doing a scene size up, or an initial checkup, you want to start from their toes to their head, because with minors, they feel scared or they feel uncomfortable when you start from head to toe, because they can't see you. When minors see you providing care from their line of vision, provides more comfort for them. As a first responder or rescuer, that's your primary role, making sure the victim is comfortable with you so you can continue providing care. So let's see, responsive victim. So here's another video.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic SAMPLE as a tool to remember the interview questions.
So what's going on? Are you in pain? really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions, and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch, and I tripped over a crack in the sidewalk. I'm just so clumsy.
Oh, I've been the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. Are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
Again, when it comes to checking for the legs or arms, you want to be sure that your victim doesn't have any broken arms, legs, torn muscles. So that's why you do want to provide this initial checkup.
Can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm going to feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm going to feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this? And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
So that's checking responsiveness or sample for adult. Check out child. So child's gonna be a little bit more different.
If your initial check of a child reveals that he is responsive and awake, get consent from a parent or legal guardian to provide care. If he does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. First, interview the child using age-appropriate language. It might also be necessary to ask questions of his parents, guardian, or any bystander. Use the mnemonic SAMPLE as a tool to remember the interview questions.
So what's your name?
Judah.
So Judah, tell me what's going on. Are you in pain?
My arm really hurts.
Ooh, your arm hurts? Does anything else hurt or feel strange?
No, just my arm.
Okay. I need to ask you a few more questions and then I'll help you with your arm, okay?
Okay.
Do you know if you're allergic to anything?
Homework.
He's allergic to amoxicillin.
Okay. Has he ever had a severe reaction to it?
No, just a mild rash.
Okay. And does he have any other allergies?
No, none.
Okay. Do you take any medications?
Vitamins.
No medications.
All right. So does he have any medical conditions?
None that I know of.
Okay. When was the last time you had something to eat or drink?
I had a bowl of cereal for breakfast this morning.
Okay. So tell me what was going on right before you hurt your arm.
I was running on the playground and then I tripped.
Ooh, ouch. Did you hit your head when you fell?
No, just my arm.
Okay.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
I'm going to check you now for any other injuries. Do you mind if I touch you?
No.
Is it okay if I take a look at him, Dad?
Absolutely.
Okay, I'm going to start with your head first. Let's take a look. Does that hurt?
No.
What about this? Okay. Take a deep breath for me, okay? And breathe out. Does it hurt to take a breath? Okay, good. Does your belly?
Again, when checking for breathing, if the person's having a difficult time breathing, that can tell you a lot, that something could be obliged in their airway. So that's why you do want to check for breathing in your initial checkup.
Belly hurt at all? Any hip pain? Okay, let me take a look at this leg. Does that hurt? What about this? Looks like you have a bruise on your shin. We'll take care of that too, okay?
It's okay, buddy. All right.
Can you wiggle your toes for me? Any pain or numbness or tingling? Good. I'm going to take a look at this leg now. Does this hurt? Does this hurt? All right. Now wiggle your toes for me over here. Any pain, numbness, or tingling? Good. I'm going to take a look at this arm now. Does that hurt? Any pain? Can you wiggle your fingers for me? Good job. Any pain? No. Okay. I'm going to take a look at your injured arm now, but I won't touch the bruised area, okay? Does this hurt?
No.
What this?
No.
Can you wiggle your fingers for me? Any pain?
No.
Okay, good. Are you having any back pain at all?
No.
All right, let's take care of those bruises now, okay?
Okay.
Thank you so much.
No problem.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
So, see the difference? With adults, you start from head to toe. Minors or youth, you start from toe to head. Again, your role in providing the initial checkup, seeing if there's anything else left over that you need to take care of that requires medical attention. You're not a doctor. You're not going to give a full report of a person's injury, but by knowing what is needed, like, hey, you have a broken arm. It hurts if I press down here. You have something going on in that arm. Let me check. It's very, very purple, very bruised. Let me provide care. It can go a long way. So, in regards to our social justice component, here's another key facilitator or key role model. This is Ann Hirschman. She was a street medic or a licensed nurse, and she was nicknamed by the LA Times a grandmother of the street medics. She's been active at every social movement since the 1960s. So a lot of the times what she would find is civil rights demonstrators during the Martin Luther King social movement, that a lot of the time protesters wouldn't get hurt from really any outside nature. What protesters would get hurt from was mobs or police officers. So what street medics did most of the time is they provided medical care because of the police brutality that was present at social movements. And she would keep providing care to protesters at other social movements. She's done it at Wounded Knee, which is a Native American protest. She did it for the Vietnam vets against the Vietnam War. And she also allied with the Black Panthers. Same philosophy that she had is restated in American Red Cross. 90% of the job is ensuring people don't become patients, promoting safeness, promoting care. So she's been doing street medic training since the 1960s, and it goes a long way. So there's a little bit of history for y'all. Now, like I said, I am not going to be here. This will be the last video recording lecture. Next week, I'll be back in person, and I'll be more than happy to go over everything we talked about. But primarily, whenever we're providing care, as you may or may have not noticed, you always want to put on PPE. The first type of PPE is gloves. A lot of time now, first responders, lifeguards now, firefighters, they have the full-on face mask now because, again, of COVID-19. You don't know, COVID-19 is spread via infected person's air particles. Someone coughs, you press on someone's chest, COVID-19 can come out. Again, when it comes to COVID-19 now, approach with extreme caution. So when providing care, primarily now because of the pandemic, we use the PPE, but we're getting ahead of ourselves. Let's focus on the basis, on the most neutral form of PPE, gloves. Now, to you, they may seem like a regular everyday device, but to someone who is trained in first aid or even nurses or doctors, this is the ultimate line of defense because, again, when you're providing care, sometimes the person can be bleeding, sometimes they can be vomiting, and gloves go a long way. So what I'm going to show you now is once you're done providing care, you want to take off the gloves. And primarily within American Red Cross Rescues, you want to put on gloves between 5 to 10 seconds. We're going to have a little race next time I'm in class. We can put on the gloves the fastest. So right now I'm just taking my time, but see this? Now that I have my gloves on, I can provide care. If someone's bleeding, someone's having a seizure, gloves are your primary source of PPE. Without gloves, it's not wise to do the rescue. But like I said, if you see a family member choking, friend, it's on you to make that call. Am I going to provide care even if I don't have gloves? So for the skill we're going over today, checking your pulse, finding it. When I have gloves, you're going to try finding it on somebody else. So when you're done providing care with gloves, all you have to do, you pinch the edge of it, because again, you could have blood on here, you could have some type of bacteria, ill. So you want to grab it, pull it outwards. See this? You want to make sure the fingers are getting rolled into the glove like that. So once you have one glove off, you want to make it into a fist. Same thing. Pinch the edge, roll out from the bottom, so the other glove can stay within there. Now it's a diaper, you can throw it away, don't keep it. That's another skill we'll be going over. So like I said, today is our last day, or the last day. It's going to be a virtual component, me in a box, YouTube video. Your role again is go over the readings, go over blended learning once it's set up. Start getting in that mindset of, okay, I'm going to be the rescuer. What do I need to do? Get in that mindset. And like I said, once I have the blended learning set up, start with the homework. With that being said, have a happy Wednesday. I'm going to see you for the first time in person the following Monday. Until then, have a great week.